Welcome to our Week 10 review session for Chapter 19, Surgical Skills 2. In this guided review, we're going to look at questions that are going to help sharpen your critical thinking and really prepare you for both exams and your clinical practice. Now remember, I am not giving you the answers here. Instead, I'm going to be guiding you with different questions, giving you some textbook hints and real-world applications that will help you think through the material. So use your textbook as your companion and take detailed notes as we go. Let's get started. Question 1. List the 9 steps to drying your hands after a surgical procedure. So what precautions must you take when you first pick up the towel? How do you keep the towel from contaminating, let's say, your scrub suit? When drying, how should you move from one part of your arm to another? How do you make sure that each hand and arm is dried separately? And what should you do immediately after discarding the towel? Look at the section on sterile technique and hand preparation. And also, imagine you're about to gown and glove for a major procedure. What could go wrong if you skip or rush a drying step? Question 2. What is the importance of double gloving? What might a single glove fail, or why, I should say, might a single glove fail during surgery? What risks are associated with punctures or tears? How could a second layer of protection improve patient and staff safety? And when might you be more likely to use double gloving in the operating room? Look at the section that discusses infection control and glove use in Chapter 19. And think about a surgery that's lasting like 6 to 8 hours. How does glove durability affect both safety and stamina in the operating room? Question 3. Before opening any sterile item, what should you do? What do you look for on the outside of the package? How can you tell if an item may have been compromised? And why is it so important to check processing indicators? What types of visible damage or marks could indicate contamination? Look at the section that covers sterile packaging checks. And imagine being the first scrub tech to open supplies for an emergency case. What consequences might occur if a contaminated item is actually used? Question 4. When opening a sterile package, list the steps in order. So how do you prepare the sterile field before opening? What checks must you make before removing the package from its container? What are you looking for when you inspect the external package? And how does the integrity of the sterilization indicator affect your next steps? Refer to the discussion of sterile field preparation and opening procedures. And think about how improper setup could delay a surgery. What impact might that have on your patient? Question 5. Explain the steps of removing an instrument set from the container system. What should be inspected before opening the seals and latches? How do you avoid contaminating the tray when lifting the container lid? Why is it so important to check filters and sterilization indicators? And how should the instrument set be handled once removed? Review the portion of the chapter that describes containerized instrument sets and sterility checks. And also consider the role of instrument integrity, especially in preventing surgical site infections. What might happen if sterility is compromised but not noticed? And the last question. Explain the sterile areas of a surgical gown. Which part of the gown are considered sterile during a procedure? How far down the gown is sterility maintained? Where do the sleeves remain sterile? And why are certain areas intentionally left unsterile? Check the section on sterile attire and gowning procedures. And also, imagine you're passing instruments to a surgeon. How would knowing sterile versus non-sterile zones influence your movements and positioning? All right, now this review is about practice, critical thinking, and connecting theory with real-world surgical application. Patient safety depends on our ability to carefully apply sterile technique, recognize risks, and act with precision. So keep using your textbook as your guide, stay engaged with your learning, and most importantly, practice applying what you know in the next modules. See you in the next session and keep up the good work.